Hey guys, it's John. So yesterday I got my nasal cast off, as you can see. So now this is what my new face looks like. It's still a little bit swollen, but all things considered, it's about 1 week post-op since the revision and about 3 weeks post-op for everything else. So yeah, this is pretty much what my new face is going to look like. My lip is still a little bit swollen, like this area feels really tight, especially when I do this, and the nose feels a little bit weird when I wake up. Feels a little bit stiff, but other than that, this is pretty much what I'm going to look like. So as you can see, the lighting in this video is a little different, and that's because my ring light showed up today. I got a ring light, a cheap one on Amazon, and I just set it up right now just to get a little bit of a better lighting so you guys can see all the little blemishes and imperfections. So with this new lighting, let's go ahead and take a look at the scar for the nose, because I think that's something I was very concerned with prior to going to surgery. And let's zoom in on that. And as you can see, it's very difficult to tell even in this super bright lighting, which it's extremely bright. Like this light is pretty much going to show all imperfections. My room, I have the room light on for my room. So there's like 4 different sets of pretty well lit light, and then there's just a ring light that's hitting my face very bright and hard. Makes this room look dark, but in reality this room is incredibly brightly lit. It's just that the ring light is so darn bright that it makes everything else look dark in comparison. But yeah, that's pretty much what my face looks like now. I think the most dramatic changes are definitely to the profile. My nose looks a lot bigger and sharper than prior to the surgery. You can go ahead and look at some of the videos I shot specifically right before the surgery so you can get an idea, but definitely the side profile is a lot more noticeable different. The chin is not very dramatic, but in fact this is the largest implant that he had, and had I not gotten a nose job, the chin would have been very noticeable. But because I have such a large nose, the fact that the chin doesn't look abnormally small in relation to the nose just goes to show how much the chin has protruded to the side, and also downward about this much, and then very far to the side, maybe about a centimeter or so, which is quite large as far as implants go. And the frontal view hasn't changed very much. If you were to go back to my other videos, you can see the most noticeable difference is the chin. And as far as the frontal view, my chin used to be roughly this size, very small, sort of a petite face. But now that this implant is in place, as you can see here, it's very noticeable. If you go back to look at the before videos or whatever, you can see that it stretches the skin here. The nose sort of stretches the skin around my eyes, and it slightly distorts the eye shape ever so slightly. The eyes has also changed a lot. It's a little bit more symmetrical before without the eyelid tape. I had one double eyelid and one mono eyelid, and now it's 2 double creases. A little bit of asymmetry, but certainly a lot bigger and more symmetrical than prior to the surgery. But yeah, not too dramatic to the front, but definitely very different on the side view. Very big difference there. So yeah, the next topic I want to talk about in this video is tramadol withdrawal. So yeah, I did the main surgery about 3 weeks ago, and then 2 weeks later I did a revision rhinoplasty. I was on tramadol for about a week or so after the first surgery, like something around 10 days or so. I took a couple of days off, like clean. I was clean for about like 3 to 4 days, and then I went back on the tramadol. So essentially I was on tramadol this whole time. My body wasn't allowed to completely withdraw and reach homeostasis the first time since I stopped taking it. So the second time I had a bit of a tolerance. I probably had about a tolerance to about anywhere from 50 to 100 milligrams, I would say. So such that the second time when I started taking it, I needed to take an additional 50 to 100 milligrams to feel the same effect. So basically, like, long story short, like right now the most difficult thing that I'm going through right now by far is painkiller withdrawal. The first time I stopped taking painkillers, I made a video about it. I felt slight withdrawal symptoms, a little bit of chill, a little bit of depression. but this time the symptoms are much more noticeable when I wake up from long sleeps and haven't taken the tramadol for like 15 hours or so, 20 hours. I feel like very severe withdrawal symptoms. I feel chills, like hallucinations, like nightmares, and stuff like that, and then severe like depression. So yeah, so like this is no joke, guys. Like when you're doing the surgery, you should take as little painkiller as possible. I didn't really have a choice because I got the revision rhinoplasty so quickly, you know. The doctor said if I did it now it would be easier because the cartilage has not set, right, set as to attach to my natural cartilage, so it's still free floating. That's why I got the revision like so quickly. But basically I was on tramadol for like a good 2.5-3 weeks, and the dosage the second time around was like much higher than the first time. And so right now, like I probably have to take somewhere between 200 to 300 like milligrams just not to feel any kind of withdrawal symptoms. But I've been tapering off about a pill or two a day, so quite a rapid taper. Right now I'm probably around on about 200 milligrams. By the end of the holiday, the plan is just to get down to like 1 pill or half a pill a day, and then just go cold turkey. But it's really difficult, guys. Like it's kind of ruining my holiday. My friend is coming over tomorrow from NorCal to hang out over the holidays, and we had all these like great plans made, but probably not going to be executing on most of them because I just feel so tired and like bummed out all the time, even though the underlying fundamentals of my life has been pretty good. They seem pretty lively right now because I took a tramadol like 50 milligrams about 2 hours ago. My total dosage today has been 100 milligrams. So yeah, but I've been trying really hard to like taper off as quickly as possible because this stuff is like no joke, and it definitely creates like severe withdrawal symptoms if you take it too long, which I have. I got like basically 2 surgeries back to back. So yeah, so other than that, like it's not that much to talk about. I'm still getting used to my looks. You know, it's kind of weird. Sometimes like I would wake up, I would go to the bathroom, you know, between like sleeps, and I would look at myself and I would get kind of like weirded out because I forgot how I did the surgery and stuff like that. And then I'd be like, oh, it's because I did the plastic surgery, that's right. So so yeah, I'm still getting used to my looks. It's just like, I don't know, the nose kind of creeps me out a little bit, to be honest. Like at night, like when I'm just like kind of like, you know, asleep and I kind of forgot how I did my surgery, I look at myself and the nose is very noticeably different than what I looked like before, and just the eye shape, just like little subtle changes I'm still getting used to. But I think also part of it just because of the tramadol withdrawal, it creates like very intense negative emotions and stuff like that. And I'm very tempted to just call the doctor and be like, hey, you know, can I just like get more pills? But I know that if I did that, it would be kind of like the European Union is just kicking the can down the road for the inevitable crash that must come sooner or later. So instead of having like a very uncontrolled crash, forced liquidations, I'm just trying to have essentially like a descending trading range, very controlled crash, if you will. And then, but the crash definitely has been happening and will surely continue to come until I reach homeostasis, which I anticipate will be well over New Year. So probably going to ruin my holidays, but hey, that's just, you know, it's part of the game, right? When you do surgery and you have to get back-to-back rhinoplasty, you have to take painkillers. Well, you don't have to, but I mean, I took them, which, you know, it definitely creates cycles. You know, what goes up must always mean revert eventually. So yeah, I'm just like trying to get through that with a good mindset and stuff like that. Other than that, there's not that much to talk about. It's day 9 post-op. Thanks for watching.